If you're in hospice, you know how important it is that your clinical software match your workflow. You need patient information to hit the chart immediately, but you also need built-in security with role-based access to protect patient privacy and be HIPAA compliant. This is especially important when working with volunteers. Hi, I'm Dana Larson, Hospice Administrator and Volunteer Coordinator. Hospice Tools eDocs has some fantastic features to manage our volunteers, keep our charts current in real time, and protect patient privacy. Logging into Hospice Tools eDocs, we see the menu bar at the top with a series of tabs. When we click on the Admin tab, we get a drop-down menu with some of the role-based access tools. One of these options is for volunteer management. Before we jump into volunteer management, let's take a look at what I can see with my access as an administrator, and we'll contrast it with the access volunteers have to see the built-in security that protects patient privacy. We'll click on View Charts and see the complete list of all our hospice and palliative patients. And we can enter the chart through the list, or we can search by name. And as soon as we start typing, the system starts filtering the patient names for us. We'll click on our patient Derek, and we're taken right to the intake screen with all his face sheet information. We'll click on the eDocs tab, and we see that we have access to our patient's full medical records and any documents associated with him. Under Intake, we have all of his personal and pertinent hospice admission information. In the Contact section, we see where our patient is currently living, as well as his caregivers and family members. Under the Financial tab, we have access to his insurance coverages. And under Sticky Notes, we have handy notes from our team. As an admin, I have access to all this information. Now let's go ahead and set up a new volunteer. We'll click on Volunteer Management under our Admin tab. Our volunteer's name is Valerie Wallace. And the default settings for a volunteer is that there are no permissions. If a volunteer logs into the system, they have no access to any patient charts until we grant access to the specific patients we want her to see. Let's give Valerie Volunteer access to our patient Derek, Alexander Lemming, and Samantha Bellamy. We'll click Save, and then when we click View, we see the patients our volunteer Valerie now has access to are listed clearly on our management page. If for some reason Valerie is no longer going to be volunteering with one of those patients, let's say she was not going to be working with our patient Samantha, we simply click on the trash can icon by Samantha's name, and the volunteer permissions for that patient are deleted. If we want to add volunteer permissions back for our patient Samantha, we simply go back to Edit mode, click on Samantha's name, and save. And we see that Samantha is back on the list of patients that our volunteer Valerie has access to. Hospice Tools makes volunteer management simple and seamless. As you see, it's really easy to set up volunteer access to patients and just as easy to remove volunteer access. Now I've logged into Hospice Tools eDocs as our volunteer Valerie Wallace. And let's take a look at the built-in safeguards that protect our patients' privacy. On our dashboard, on the top menu bar, we now only have the tabs Home and Patients. We'll click View Charts, and we see, when logged in as a volunteer, instead of the full list of patients, the only patients that appear are the specific ones we granted Valerie access to. In addition, when we click on a patient to enter their chart, whereas before when we logged in as an administrator, we had access to the entire chart and we could see the complete medical record and all the other information associated with the patient, a volunteer does not have access to the clinical documentation. They can't even see that the documentation exists. The intake information is limited to just the information our volunteer will need in order to do her visits with the patient, the basic demographic information, and the patient's diagnosis. And the volunteer can see contact information, the location of the patient, and caregiver contact details. The tabs for financial information and sticky notes are not displayed. The volunteer doesn't even know those tabs exist. Now let's go ahead and create a volunteer visit document. We click on New Document, and we'll select our patient Derek. And when we click on Form, you can see whereas when we log in as a clinician or admin, we had a whole library of forms to choose from. For volunteers, the only document that shows up is the Volunteer Visit Note. This also makes the system extremely easy for the volunteer to use, in addition to protecting patient privacy. We put the time in and time out. Let's say this visit was done on October 14th. We started at 9 a.m. and we were there for half an hour, so the visit ended at 9:30. Then we enter the type of contact. In this case, it was a visit. And then we document the services that we provided. In this case, we provided social and emotional support. We did some housekeeping and a bit of laundry. There is also space for free text. We'll also note other people present during the visit. If the patient, for instance, has a caregiver, we can go ahead and document that. In this case, we will put that the caregiver Rana was present. We'll also document observations or description of the visit. We'll note that Derek enjoyed the meal preparation and Rana appreciated the laundry help. And we can document any concerns the patient or family or volunteer has. In this case, we'll mark that there were no concerns. And then we can identify any urgent needs. Let's enter that Derek also would like assistance with housekeeping. And then we put the date on it. We can click on the calendar or enter it manually. And that's a volunteer visit note, very simple and concise to fill out. Now we can go ahead and click Sign and Submit. And the document was submitted successfully. Now I'm going to log off and go back in as the volunteer coordinator so we can see what the documentation looks like on the volunteer coordinator's dashboard. We're going to go ahead and log back in as Dana. And we see right when we log in, the volunteer visit note is right there on our dashboard. Dana has the ability to go ahead and review and approve or reject the document. This way, the volunteer coordinator can look at any documents before it's submitted to the chart to be able to audit it and review it or give feedback to the volunteer. We'll open up the document to review it. We see the entire document present with all of the details, and then we can either approve or reject the document. If we were going to reject it, we can add a comment why, and it will go back to our volunteers' dashboard so they can make any changes that are necessary and then resubmit. In this case, it all looks good, and so we'll go ahead and approve it. And by approving it, the document will go directly into the patient's chart as the final version. Let's go back into the patient's chart so we can see exactly where the documents have been filed. We'll open Derek's chart, and we see the volunteer visit note with a little green bubble, and that it's been finalized and submitted. And that's the simple and easy way that Hospice Tools helps us manage our volunteers, keep our charts current in real time, and protect patient privacy. Hospice Tools, how hospice happens.